camera now, but we're gonna still talk. I've been working on this guy for I've probably given him about 3,000 pounds worth of effort, and you can see that his muscles are still a little tight, but they can move. Look at that. That is much better than it was before. Still some tightness in the anterior trap, but much better. Look, okay, you just tightened up. Okay, let me see. There you go. Okay. He still has some tightness in his scalenes and his paraspinous muscles. But this is, the goal is to turn this into butter. He's tight in there too, tight in there too. This is loosening up. Okay. A couple of months ago, I couldn't get 25 gauge needles in here. So now I'm able to get 27 gauge needles, and that's what I'm going to work on now. So I'm going to start here and just work down. That went in so smoothly. That feels nice. Feels nice. Yep, yep, yep. The one thing that people don't quite understand is that I'm not only feeling, I'm treating, detecting, scouting, sort of like doing reconnaissance. Because a needle tells you and talks to you. The patient tells you and talks to you. Okay, so some people think that this is just wham bam thank you ma'am and you're done. No, it's not. It takes a lot of time and effort. Then you have to recruit the patient to help too. Are you using your needles? Okay, good. Because I can't do it all. You can't do it all. You need a team, and you have to recruit the patient. Pinch. And he's probably applied about 1,000 pounds of effort too. And he's still down probably about another 2,000 pounds. Don't know until we get there. How you doing? Okay. And it's still a little gritty in there, but it is going in nice and, oop, that was something there. You okay? Get that. So you feel the restrictions, and as you peck at them, they'll loosen up. And once they loosen, you've deactivated the trigger or the muscle. I'm not going to say trigger point again. You deactivate you hit the release mechanism in the muscle, and then the muscle acquiesces, and then it relaxes. Oops, okay, so I'm going to get these scalenes. Oh, there it is. Okay, here we go. I'm kind of puckering out that so I can get in there and have a little leeway. I'm still, I guess, oop, there it is. Oop, there it is. The spinous, I have my thumb on the spinous process, the lateral one. So if I stay posterior, I'm safer. And how we doing? Now this is the combination of wet, dry. This guy is so tough, I could take a hammer and chisel and he wouldn't move. But for, how can I say it, kindness, I put in the lidocaine. You don't have to torment or torture people. That adds to the problem. Oh man, okay, here we go. So I've got the anterior trap, and I'm gonna hook it right there, so it's got it in between my fingers, and then I'm gonna attack it. Oh, you okay? And notice the direct. Ooh, ooh. Pause. Put a little lidocaine in there. Sometimes you have to. You okay? Still there or gone? Okay. You okay? There it is right there. You don't know it's there until you feel it. And you can only feel it with touch. If you don't touch it, you can't find it. I just made that up. How we doing?
Okay.
Ooh. This is the worst side, so I'm focusing over here. Do me a favor, put this arm here for me and let it fall. Okay, good. See, it's up a little bit, so I have to get in this area to release all of this. So his neck starts here and it ends here. So if I'm treating his neck, I have to treat his whole neck, not just this part, the whole thing. Pinch. See what's in there. You okay? There's some arteries in this area. Sometimes you'll hit one and then you get a bleeder, but you just put pressure on it, and some heat, and okay. Is this not uncomfortable, is it?
It's a little uncomfortable.
Okay, go ahead and straighten it out for me. Straight, yeah, there you go, there you go. There. So where was it uncomfortable? In here?
Yeah.
In here? Or?
There, but then also it puts a little pressure on my head.
Okay, good. I'm glad you said that. Because the levator hooks right to your head. So that's where I'm going to go now. And I'm lifting up, pulling everything away from his rib cage, and I got it right there. Got a little kick there. There's an artery here, and I'm probably going to hit it. And you're probably going to get a bruise, but that's okay. Just do what you need to do. How we doing?
It's good. I can feel it releasing pretty good.
Okay.
Okay.
I think I just felt it release. Yeah.
Yeah, it's the side of my neck feels better.
Okay, so a lot of people think this is, again, wham bam thank you man, but it's interactive. This is the best way to do this. And anything less I would consider incomplete. And anything incomplete is not fair. And anything that's not fair is just not fair. Ooh. Okay, all right. Yeah, there's still something right there. I'm gonna put another layer there with a different tool. Okay, let's see. I'm gonna get this guy. There we go. I'm gonna get this guy here too. Let me see. Ooh. There it is. You ready?
Mm-hmm.
Okay. Okay, there. Okay. Oop, there it is. And if a person has a problem on the right side of the neck, he has problems on the left side of the neck. More than likely have problems at the top of his neck, which is the top of his head, and also in his shoulders. So there's no such thing as a neck. Yeah. Let me get another syringe with some stuff in it. You okay? You're gonna edit this out, okay? Okay, how are we doing? Another important concept is that people also think that this should be done sterile, and it's not necessary. Acupuncture is a clean procedure. This is a clean procedure, and over the decade, it's just not necessary. I'm gonna get these guys here. Ooh, okay. Ooh. So this is the stimulation part. If you just put the medicine in, you're tricking yourself. You are the original designers discovered that you had to stimulate. It's not so much what you let me get this part. It's not so much what you put in. It has a lot to do with the fact that you have to stimulate. With no stimulation, you're wasting your time. Pinch. I put in a little bit more anti-inflammatory in here because this is going to be sore. If, again, you know what you have to do if it gets too bad, and it's just not, it's not releasing. What I'm gonna do is I'm gonna put another layer on and let you soak, and then I'll be back. Oh, you're gonna have a bruise. Gonna have a bruise. You been back swimming?
No, I've just been walking a lot and stretching.
Okay, good. And again, there's no such thing as a neck. There's no such thing as a knee. There is the quadrant that joint is on, and this joint is all of this. If you do not treat the whole joint, that's incomplete. And I would not incomplete a treatment for cancer. Why would you incomplete a treatment for pain? Just doesn't make sense. Oop, you're gonna have a bruise down here too. Now, in some cases, you really have to apply enough force to bruise, because if you don't bruise, you can't invite in Mother Nature, and that's the key, is to ignite Mother Nature so she can do the mending. This is basically assisting Mother Nature. Now, you're listening to what I'm... Okay. Because the injury is in the muscle fibers. The only way you can get there is to stimulate Mother Nature into action. The force of the muscles blocks Mother Nature. And you can't cheat, you can't force her to do something she cannot do. So you have to assist. You have to assist. No assist and nothing will happen. Once it gets to this point, everything gets locked up, bound up. Actually, there's a term I give this. The cells begin to act like cancer cells. They are not alien. I mean, they're not normal. They're not yours. They're alien cells. And alien cells are your enemy, and your body will fight against them. And they'll start releasing toxic substances that will make you sick. So a sick muscle cell is a sick person, and it's all invisible. Oop, how we doing?
I'm doing good.
Okay, all right.